Department of Health in Gauteng has launched an investigation into an incident at the Kalkot Lepu Clinic in Tsakane, that's in Ekurhuleni. In the video that went viral on social media, a man is seen throwing a substance thought to be urine at staff at the clinic. This apparently because he was dissatisfied as patients were waiting for hours on end to be attended to while staff members were engaged in their own activity. We're now joined by Modalatale Modiba. He speaks for the Department of Health in Gauteng. Thank you very much for availing yourself this afternoon. What is your understanding of what happened at this clinic?
Thank you, Judy, for this opportunity. I think your explanation in terms of saying that a member of the public was aggrieved, and from that incident of being aggrieved, they then decided to obviously voice out their unhappiness. Unfortunately, in voicing out their happiness, they ended up pouring or throwing urine at staff members. And I think that's the part that we had to obviously come out and speak against, to say, irrespective of how maybe dissatisfied people might be with how we are rendering maybe some of our services, there are mechanisms and rules that I think people can be able to use to still voice out their concerns without necessarily violating the rights of the healthcare workers. Because, I mean, when you do that, at the end of the day, you're likely to have a much greater impact in terms of the negative effect on service delivery. So what we're saying is that we are appealing to the public that we do understand that there are times where we might not maybe render services, or we might have certain shortfalls in certain instances, but that should not necessarily create an environment where we react violently, or we react in the manner in which the person in the so-called video that has been circulating reacted.
To your understanding, Mr. Modiba, how far and wide is this behavior of non-performance, as you put it, by some members who are employed by government to render a service to the everyday person that may not necessarily afford to go the private route in South Africa? So how far and wide is the problem, to your understanding?
Look, we've got quality assurance offices or officers at all our healthcare facilities, just like in any other institution that renders services. And part of the work that those quality assurance officers do is to ensure that they actually receive complaints or concerns from the public, so that as part of our commitment to keeping Tuba-to-Pili principles, we're able to redress. And that's why at Gauteng Health, we are open to receiving views from the public. Even at each and every facility, you find those people being there, whereby if you're not happy with, it might be whatever issue that you're not happy with that relates to our services, you are able to lodge a complaint or even speak to the facility manager. And if you're not happy with that, you're able to escalate. So from time to time, yes, we will receive complaints, but of lately, there has been some improvements, especially with the many oversight visits that the MEC has been doing across our different facilities, and also using other instruments to actually monitor the levels of service. We are seeing an improvement in terms of how the services are improving on the ground, and also how members of the public are also able to engage with us in terms of raising particular issues, so that we're able to address those issues. And that's why this particular clinic that we're talking about, it's a municipal clinic. It's not a provincial clinic, but because we have an overall, obviously, oversight role and responsibility in terms of ensuring that healthcare services are rendered to the public in the province. We have obviously taken interest in this particular incident, and hence a team has been dispatched, obviously, from central office to work with the team from the municipality to understand the incident, what happened there, what could have led to that, and that's why we don't want to make excuses. But what we want to say is that it doesn't matter if the levels of unhappiness, but there are just 10 things we don't do. It's almost like if we allow that, the next thing we will allow someone to ban a clinic because they are unhappy about maybe water or the roads, the quality of roads. You can't do that. You don't correct one wrong with a wrong. You can still address the issue of unhappiness and make yourself heard without necessarily resorting to actions that might actually, in the long term, lead to that very same service that you are fighting for being difficult for that service to be rendered to you. And I think that's the plea that we're making with the members of the public. I mean, and it starts with small things like this. You would know that in December we're busy with a campaign on protecting our healthcare workers, where you saw that even ambulances, when they go to communities, people attack ambulances, they get robbed for no reason. So we can never condone actions of violence. We can never condone such kind of actions as has been seen on this particular video. But we do accept that where we've got shortfalls insofar as service delivery is concerned, we are saying to the public, our doors are open, engage with the facility managers there. Fortunately for us as Gauteng Health, even on our website, our contact details are available. So there are many avenues that people can actually be able to explore. In fact, we encourage people to engage with us, to work with us, to ensure that we improve the quality of healthcare services, because it is in our interest that we build a healthcare service that is responsive, a healthcare service that is patient-centered.
Mr. Modiba, I mean, that the fact that somebody can go to such an extent where they do something like this speaks to a total breakdown in trust, right? And so you speak of processes and how the public should complain. Yes, that is indeed correct. What do you say to somebody who wakes up at 3 a.m. to make it to the clinic on time so that when they open at 7 a.m., they are maybe number 10 in the queue? Then they are not attended to. By the time somebody actually is done with an investigation, when you have an urgent, pointed illness at that moment.
Unfortunately, I think the scenario we're painting obviously is an exaggerated scenario in terms of what really happens at facilities. And this was not the case in this particular incident. And I don't want us to get into a space where we seem to want to justify the behavior of the particular member of the public.
That is not what I'm suggesting, sir. And that is why I was asking you. I do beg your pardon, far from it. And that is why I'm asking you, because if you do ask people who go to public health facilities, Mr. Modiba, you wake up very early. And it's far from condemning. That's not, I mean, from promoting that kind of behavior. I'm just trying to understand the department's understanding in terms of what people are faced with when they go to public health institutions, where you have to wake up super early in the morning. You get there, you're still number 10 in the queue, and you're not attended to. So these frustrations, they could be dealt with, and the department could be, yes, you are doing some work, but far greater work could be done.
Yeah, obviously, in Gauteng, you would appreciate that we do have a unique situation of having more and more people coming to Gauteng, obviously, to receive services. And the reason why that is the case is because of the services in Gauteng are accessible, and that obviously attracts to large numbers to many of our service points. We see it in the numbers of people that are coming through to register for their children to study here in Gauteng. And the same scenario, we're seeing it obviously in health facilities where there is an overwhelming number of people. And that's why, for example, as the Department of Health, we're working on basic things like automating our systems, your queue management system, to ensure that patient files can now be accessible from one facility to another. You don't have to carry your files with you. Electronically, they are available, so that the members of the public have got access to a wide to all our facilities. That if you are used to getting service at facility A, it shouldn't be a problem now to go to facility X to receive services, because your file, when we get there, it will be easily accessible. We've started with that particular process to ensure that the health information system is improved. We ensure that we put in place a queue management system that actually even notifies you. We've even gone to an extent of now, even with your medication, you no longer need to come, if you are a person who receives chronic medication, to come to queue for that medication, because you can actually register on what you call double up. What that means is that you register on the system. You no longer need to go to any healthcare facilities. You go to a remote point at your favorite mall. You will find that your medication is there. You are able to collect without having to queue, because some of the issues that people queue for are not necessarily, it's not necessarily that they're queuing there because you have come there because you are terminally ill and all of those things. It could be a question of saying you are coming there to receive a particular service that you could have actually gotten access to without you necessarily needing to queue. And obviously, one of the things that we are doing now is to improve public advocacy or public education in terms of saying what are the referral pathways within the healthcare system. When do you need to go to a clinic? When do you go to a higher level of care? That is not to say we shy away then from the challenge that we're facing. Yes, we're still facing challenges on the ground, given that we've got an overwhelming number of people that require services, and hence part of us responding is to also ensure that we also get to increase the service points. We also get to increase some of your primary healthcare facilities that get to operate on a 24-hour basis, such that then if people have got more options in terms of being able to access our healthcare facilities. There is a plan on the ground. We are working on that, and there's a number of interventions that we're currently working on, which should actually assist us in ensuring that we smoothen the services. And I think the MEC has made a commitment that she is listening to some of these things that people are raising on the ground, and as she then also obviously put pressure on the administration to ensure that I think we work speedily to address some of the low-hanging fruits like your patient records, your queue management systems, and also diverting people that need to come and receive their medication to actually receive it remotely if you are consistently receiving certain types of medication at our facilities.
Mr. Modiba, can we take this moment also to just shout out or to give praise to healthcare workers who are doing an amazing job in spite sometimes the most difficult circumstances?
Thank you very much. Indeed, it's not an easy task that is before us. It's a job that we need to do, but we need to do it with passion, with heart, being mindful that often than not, the health platforms are your last line of defense in that one way or the other we interact with people from across. And I think one of the things we're emphasizing now with our employees through some of the campaigns that we're doing internally. We've got a campaign now that we've engaged on called Serve with a Smile, to say, yes, even ourselves as frontline workers, we do have our own challenges, but because we've committed ourselves, we've taken an oath of service to provide the best of service to communities. Let us at least serve them with a smile, because sometimes a smile is all that it takes. And when you show empathy, people are able to understand. When we've got whatever challenge that we've got, and you're able to work with communities, and communities are able to also even support some of the initiatives that we've got. So we do appreciate when people obviously give us feedback, not only the positive feedback, even the negative feedback is still appreciated, because the aim is to keep on improving how we render services, so that we are patient-centered in how we render our services, but also we are very responsive in how in point out areas where we're not doing well, we're able to be more responsive.
Talatale Modiba speaks for the Department of Health in Gauteng. Thank you very much for your time.